With Nightingale College, and today I'm going to be demonstrating an intramuscular injection. First thing we're going to do is gather our supplies, which are going to be gloves, 2 alcohol prep pads, gauze, 25 gauge 1-inch needle, and 3 milliliter syringe. And we're also going to grab the medication vial and a band-aid. Sorry. Next, we're going to go ahead and verify the healthcare provider order and compare it to the MAR. The order reads 6 milligrams of morphine sulfate intramuscularly. And then we're going to verify the 6 routes of medication administration, which are the right patient, drug, dose, route, time, and documentation. Next, we're going to perform the calculations necessary. So we're going to do 6 milligrams divided by 4 times 1. So it's going to be desired over half times quantity. So we're going to have 1.5 milliliters that we're going to be administering to the patient. Next, we knock on the door, perform hand hygiene, and pull the curtain for privacy. So next, we're going to go ahead and introduce yourselves. Hello, Mr. Victor. My name is Fred Huerta. I'm going to be your nurse today. Could you please tell me your name and date of birth? Okay. Mr. Victor, I'm just going to verify your name on your wristband and make sure that name correlates with the name on the order, the healthcare provider order. Okay, so before we continue, Mr. Victor, is it okay if we speak about your healthcare information in front of your guest? Yes? Okay, great. Victor, can you please tell me if you have any allergies to food, medication, or seasonal allergies? No? Okay, great. Victor, your doctor has ordered morphine sulfate 6 milligrams intramuscularly, so it comes in the form of an injection. This medication is used to treat moderate to severe pain. This medication is an opioid analgesic. This medication works by binding to the receptors in your central nervous system, altering the sensation of painful stimuli. Some common side effects of this medication are nausea, constipation, and dizziness. If you experience that for an extended period of time, please let us know. Some adverse effects that we'll be looking out for would be chest pains, tachycardia, shortness of breath, or if you feel like you're about to pass out, please let us know and we will help you out. Okay, so do you have any questions for me at this time? No? Okay, great. So I'm going to go ahead and scratch my nose. Sorry about that. Then perform hand hygiene. We got all our supplies. We're going to put on some gloves. So put on our gloves. And then we're going to grab our syringe and connect it to the needle. So we got the 3 milliliter syringe. Go ahead and connect it to our 25 gauge 1-inch needle. Twist it on. Place that in the trash. And then we're going to go ahead and we're going to be administering 1.5 milliliters. That's going to be our dose. So we're going to go ahead and pull the air to 1.5 milliliters. Right there. We're going to verify that this medication correlates with the name on the order, and the name that the patient stated. Okay, so we're going to get an alcohol prep pad, clean the top of the vial, and then we should be good to insert. Okay, I'm going to dispose that into the trash. Okay, now we're going to go ahead and uncap the medication. Place it right there. Grab the vial, poke it in, and then we're going to go ahead and inject the air into the vial and hold it upside down, invert the medication, and then we're going to pull 1.5 milliliters. Okay, so if you have bubbles, you're just gonna flick the syringe, making sure that they're just like that. Flick the syringe, or otherwise, if there's too much air in there, you're just gonna inject it all back in and then withdraw from the beginning. Okay. So right now, I got some air in there. Inject it, and then okay. So we got 1.5 milliliters of morphine sulfate. We're going to use the scoop technique. Cap that. So we got 1.5 milliliters of morphine sulfate. Okay. Now we're going to place that, put that on the side. Next, we're gonna administer the medication. We're gonna locate the site. So we can put the medication on our deltoid, on the ventus lateralis, or the gluteus ventus. Gluteus ventus. Okay, so we're gonna place the medication in the gluteus ventus. So we're gonna place our palm on the greater trochanter of the hip. Place the patient on their side. Have our palm on the greater trochanter, and then my thumb's going to be pointing to the patient's pubic region or their groin, and then my index finger is going to be pointing to the iliac spine, so around there, and then my middle finger is going to be pointing to the iliac crest. So the right here is the location in which I will be administering the medication. So this is going to be my site. Now that it's there, I'm going to go ahead and assess the site. I will look for any signs of irritation, bruising, or inflammation or edema. And I'm going to be palpating for tenderness, or if I see any masses. If I see a mass, I will not inject the medication there. Okay, so next I'm going to go ahead and grab, once we've assessed and inspected, I'm going to go ahead and grab an alcohol prep pad, and then going to clean from inner to outer, approximately the length of 2 inches. Okay, and then dispose. Okay, now that that's clean, I'm going to let the patient know once again that once I administer the medication, you might feel a stinging sensation. Okay, make sure that this medication is the patient's medication that has the same name on the order and the name that they gave you. Okay, so we're going to grab the medication, their dominant hand. Okay, I'm going to uncap it. With their non-dominant hand, we're going to pull this back on the skin so the skin's taut. And with the thumb and the forefinger, you're going to spread the skin and not touch the site we just cleaned. So where we're going to be injecting it, I'm not going to touch it. I'm going to spread the skin around it. Okay, so I'm going to come in and insert it at a 90-degree angle straight in. Okay, so I'm going to insert the medication. Okay, and feel it. 1, 2, 3. Okay, so we're going to insert it quickly. Okay, now I'm going to, with my non-dominant hand, grab the syringe, and I want to pull back 5 to 10 seconds, making sure no blood comes out. And there's no blood comes out, so that means we're in the muscle and not in a vessel. Okay, now we're going to go ahead and inject 1 milliliter for every 10 seconds. Okay, we'll leave the syringe there for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're gonna remove the syringe, the needle, let go of the skin, place a clean gauze on top, and then dispose of the syringe into the sharps bin. Okay, and then we're gonna go ahead and remove the gauze. Assess if there's bleeding. We can place a band-aid. In this case, the patient's not bleeding, so we will gather our supplies to dispose of all the trash. Ask the patient, are you feeling okay, Mr. Victor? Do you feel okay? Okay. So here's your call light. Here is, we're going to put the patient in a comfortable position, put any fall precautions if needed, and then we will remove our gloves, perform hand hygiene, and document our procedure. And document. Okay, thank you.